So I just want to go through a quick way on how you can help yourself release the plantar fascia. Now, in mostly everyone I've ever worked with, their plantar fascia is restricted. Now it's interesting, the fascia, the connective tissue that's on the base of the foot, the sole of the foot, actually directly connects to the front of your eyebrows. It's what we call the superficial back line. So what happens is it connects on the plantar fascia, wraps up the back of the heel, up to the Achilles, to the calf, to the hamstring, to the glutes, up into the lower back, up the length of the lower back, to the neck, over the head, and actually wraps around and connects to the top of the eyebrows. So if you kind of just imagine that and then think of migraines, neck ache, upper back pain, lower back pain, even things like sciatica that comes from inside the glutes generally, you know, feelings, pains in the hamstring, knee pain, tight calves, calf pain, ankle pain, it's all on this same line. And any tightness anywhere in that particular line can be felt everywhere else. So this is just a nice way to release the calves. And again, sometimes it can just feel quite nice as well. So you're going to take a lacrosse ball. You get these anyway, you get them online. We have a link on our website if you want to get it from there. But in essence, a lacrosse ball will do something that's quite sturdy. And again, if your feet are quite sensitive, by all means start with a tennis ball. Now, I'd say start sat down first, just to get a feel for it and how the intensity feels for you. Essentially, you're going to put your foot on it, you're going to push your foot down on it, gently at first and just roll. Essentially, we're just looking for tender points. Now, for most, it's not going to feel that comfortable, and that's a good thing. We want it to be uncomfortable because we want to break these knots in the tissues up to create more space and more fluidity in the movement. So essentially, start working into it. You can work up to about a minute, but then ideally you would start to build on that work up to like 3, 4, even 5 minutes per side if it feels uncomfortable. And essentially you're just going to kind of chase that tightness and restriction away so the whole length of tissue can just release and get back to its original length, so it's not kind of pulling on joints in the body and causing tension or torsion or even pain. Once you're happy doing it sat down, then you would just stand up and then you would just work into it, pushing down. And essentially, you can actually start to go into it where you're able to just stand on the ball like that with essentially no pain. That's when you know kind of you've got it perfect. But even if you do that and it's uncomfortable, it's still 100% better than not doing it at all, and it may just be the answer you're looking for.